What would you do if you had a tick on you right now? Would you follow the old wives' tales and cover it with clear nail polish? Or maybe you would stick a hot match to it in hopes it would climb out. And after all that, would you keep that tick or would you dispose of it? I think the most important question here, though, is would you be concerned about your health? Maybe you have a good reason to be. Because out of all the vector-borne disease cases in the United States, 75% of them are tick-borne disease. According to the CDC, cases have more than doubled in the past 13 years. Additionally, due to the complicated nature of testing for these pathogens in humans, these numbers are vastly underestimated. So the threat of tick-borne disease is greater than we even realize. So why do you care? Well, if you go on hikes, to dog parks, or even to your own backyard, you're at risk of a tick bite and therefore a tick-borne disease. You've probably heard of Lyme disease, but there are other types of diseases that are carried by ticks that can cause illness in humans, such as Rocky Mountain spotted fever, ehrlichiosis, and tularemia. However, it's not just avid outdoors people who are at risk of tick-borne disease. For example, if your family dog gets bitten by a tick, you might end up like this poor guy here, because they're at risk of canine anaplasmosis, canine ehrlichiosis, and canine babesiosis, just to name a few. People in the agriculture industry are also having issues with ticks. Recently, our collaborator, Risa Pesapane, visited a farm where the cattle had been bit by so many ticks that it had been drained of all of its blood. Additionally, ticks can transmit an organism called Theileria to cattle, which can lead to some pretty expensive vet bills for farmers. So why can't we just test humans and animals for these diseases and treat them as they occur? Unfortunately, it's not always that simple. There are a few barriers to that type of testing, such as doctors who know which tests to order, laboratories that can perform the testing, and the timing of disease onset versus specimen collection to ensure accurate results. So to overcome these barriers, our lab has adopted a method that general surveillance laboratories have been using for a while, testing the tick itself. Think about it. It's more proactive to pull the tick off and send it in to get tested than it is to wait for clinical symptoms of illness before visiting your doctor. If it were me and a tick that I pulled off of me tested positive for Lyme disease, I would take those results to my doctor to get tested. To be transparent, there's no guarantee that a tick that contains Lyme disease will transmit the illness. But it's a next step if you're concerned. So how do we do this testing? To address this, we need to talk about the nature of these ticks and the bacteria that colonize them. Interestingly enough, only certain species of bacteria can inhabit certain species of ticks. For example, the American dog tick is well known to transmit Rocky Mountain spotted fever, but it is not known to transmit Lyme disease. On the other hand, the black-legged tick is well known to transmit Lyme disease, but it is not shown to transmit Rocky Mountain spotted fever. This is why it's so important to determine the species of the tick before we proceed with any sort of pathogen testing. This saves both time and money. So what we've done is we've narrowed down 7 species of tick that are most common in Ohio, most relevant to humans and animals, and most likely to transmit pathogens. We use a thorough protocol and a high-resolution microscope to determine the species of the tick. Once we do this, we can move on with the extraction step. Ticks have an extremely hard outer shell that needs to be broken down before we can gain access to any type of genetic material. So we crush up the tick so that we have access to both the pathogens and the tick. We proceed with our extraction of DNA, and once we have the tick DNA and the pathogen DNA, we can proceed with a test called real-time quantitative PCR, which involves amplifying the DNA and tagging it with a fluorescent dye so that we can determine how much, if any, pathogen DNA is present within the specimen. However, to be able to do this at a large scale, we would need to be able to test for multiple pathogens at the same time. So this is where the art of multiplex qPCR comes in, which is what I've been working on. This entails tagging multiple sequences of DNA with different fluorescent dye. This allows us to determine the type of pathogen present and the quantity. These can be a little tricky to design because there are multiple molecular components that have the ability to interfere with each other. However, thanks to the help of my tick experts, I picked out singleplex assays that are well known and tested and combined them to create multiplex reactions that work very well together. This saves time and money again and reduces the amount of tick DNA that we need. So this creates the perfect scenario for tick testing at a very large scale. So back to why we would even need that. Veterinarians, people in the agriculture industry, and even individuals like you and I can benefit from this service. This data can help inform the healthcare decisions of pets, livestock, and humans. Although it's not foolproof, because we're not testing the host itself for the disease, it's still a next step to take if you're concerned about the health of you or your animal. In the interest of public health, we're lucky to be part of a huge research institute here at OSU. So we can send our data to the Ohio Department of Health so that they can inform the public about our findings. For example, signs like these might go up in parks where Lyme disease is prevalent. You might start to see more and more of these signs going up in your favorite park because, as you can see, tick-borne disease is spreading rapidly across the United States. We can help contribute to this data because we might find ticks or tick-borne disease that haven't officially been documented in Ohio or are more common than experts currently believe. This will benefit everybody as doctors and veterinarians learn to watch for clinical symptoms in their patients, and farmers learn the best methods for tick control for relevant tick species in their area. So, if you ever do find a tick on you, it might be worth pulling off carefully and sending it to a lab to get tested.